Thank you, Dr. Confidence Ogbomade, for coming on the program today. And Nigeria's maternal mortality rate ratio is very high by global standards. In 2024, maternal health in Nigeria remains a significant challenge. The country accounting for 28.5% of global maternal deaths. A Nigerian woman faces a 1 in 19 lifetime risk of dying during pregnancy, childbirth, or postpartum, compared to 1 in 4,900 in more developed countries. And we know the northern regions, particularly the northeast, are the hardest hit due to ongoing conflict, displacement, food security with women and children being the most vulnerable. Of course, efforts have been made to address this issue. The Nigerian government has introduced programs like the Basic Healthcare Provision Fund and expanded primary healthcare services, including comprehensive emergency, obstetric and newborn care centers. But however, challenges persist, such as a reliance on traditional birth attendants due to perceptions of better care and the lack of trust in modern health facilities. And about 40% of Nigerian women still deliver outside health institutions despite available services. According to reports from African Perceptions, Healthy Newborn Network and Journal of Global Health Reports. And then there are significant gaps in essential maternal services like antenatal care, skilled birth attendants, and of course there are stark disparities between urban and rural areas in terms of healthcare access. Then we'll talk about adolescent pregnancy that are very high, which also contributes to these staggering figures. So, Doc, what do you think? How do Nigeria compare in terms of global statistics? And what do you think are the factors that are making these figures so alarming?
It's not news, and it's very obvious that maternal health statistics in Nigeria and indeed developing countries and low-resource countries like Nigeria are in 3 digits. In fact, 4, because as at 2020, we had 1,027 per 100,000 live births. And compared to high resource settings and developed countries that have single digits figures. So Nigeria is lagging behind, and we even need to meet up with the Sustainable Development Goals. So we have a long way to go. We battle with the twin demons of poverty and ignorance in Nigeria, particularly. So there are so many, this poverty and ignorance, this is just the broad arms for why things are the way they are. There are other reasons. Access to healthcare facilities, for some, it's an issue. So, for instance, I'll just give a practical example. Yesterday, I've been on call, and yesterday night, a woman was brought in as an emergency. As soon as I rushed downstairs from the labor ward, the woman was already dead. She delivered in a remote place in a maternity home and had complications from there, was sent to another hospital. Then before getting to us specialists, it was already too late. So there is delay in seeking medical care. We talk about 3 levels of delay. There's delay in seeking medical care, which can be as a result of poverty and ignorance. And then even when they decide to come to the hospital, there's the means of getting a mode of transport, because they came in a chartered bus. So you can imagine what the time it would have taken them to leave the hospital where they were referred from to us. She was referred in the afternoon. She got to us at about 9 p.m. So those delays account for maternal. We didn't even have a chance to save this young woman's life, which is regrettable. So these are the things we battle with. Poverty, limiting people's access to medical care, and even the options they can get. And then ignorance, to recognize that a symptom they are having is not one that should be ignored or one that should be taken lightly. So, and then also paucity of properly trained healthcare workers. Why that is masked in Nigeria in a way, because people are able to get medicines over the counter in almost every street. in an urban area, there is a chemist shop, there's a medicine shop to get medicines, or a shop somewhere where an auxiliary nurse is administering infusions and all, which is not even ideal. But then those things tend to mask the gap we have in healthcare providers. There's a wide gap. So these are the issues as well. So there's also long waiting times when patients get to the hospital, especially government hospitals, having to go through a lot of logistics and all that. And then even the large patient load too. So it's a lot.
Exactly. Yeah. It's a lot from what you've analyzed. So basically what you're telling us is that limited healthcare access impact these figures, and also economic and social barriers has an influence in these healthcare outcomes and access.
Yes.
Oh, great. So at this point, I also want to ask, with all these challenges you've mentioned and these problems, is there a role technology can help to improve this? Can we leverage the recent advancement technology to close this gap? And are there any examples you could cite for us?
Of course, we are in an ever-changing world, and technological advancements are leapfrogging at this time. But sadly, Nigeria is still lagging behind because of, in fact, this poverty and ignorance, like I refer to them as twin demons, you know, they are making us lag behind in uptake, in the use. For instance, abroad, EMR, telemedicine, wearables, all these things are things that are now really being explored on a large scale to help advance their healthcare delivery. But in Nigeria, it's still evolving. It's still evolving. Let me give because there are different arms for technology, really. Yeah. For example, electronic medical records. In the hospital where I work, a government hospital, we just fully adopted, we started partial adoption of EMR. EMR means electronic medical records. We started adoption of that sometime, I think it's close to 2 years for the clinics. But then in the past 2 months, in July precisely, we adopted electronic medical records fully for running the whole hospital, which is, you know, remarkable for government hospitals. In the past, it used to be that when patients come, they'll go to pull their folders first, and then they may come back with a report that, oh, the folders are missing or some pages are fallen off. But with electronic medical records, that's not the case. You just need to have the card activated and then we attend to them. So it is limiting the time, the waiting time. On the other hand, it now brings up an issue of internet connectivity. We use wireline, but local wireless network. But on some days, network is poor, it slows down the work. In fact, this week, we still grab, but these are teething issues anyway that will be fixed. But it's just to put in perspective the gap, how we are feeling it, and even the challenges to filling the gap. In terms of telemedicine, bringing in the part of addressing ignorance as well. There is room for, okay, this is not really technologically driven anyway, but the room for education and advocacy. Also, access. Another point I talked about was getting access to qualified and trained healthcare providers. There are some, what is it called now? There are some telemedicine, or let's say apps or setups that are trying to fill in this gap. There's one I see on Twitter. I've never really used any of them.
Okay, Doc. Sorry, I was about to ask that same question. Is there no way telemedicine and mobile medicine apps can help
Yes, that's where I'm going to really.
Yeah.
Because I even found that even some HMOs are trying to not even trying, they have started using telemedicine. There are a couple of others too that are not yet very popular. There's this eDoctor Health or something. I see their page on Twitter. I've not really used them. I've not explored their platform. And then for the part that concerns me, my career, my field, OBGYN, I'm passionate about women's health. I'm passionate about advocacy. So there's one run by Dr. Ifunanya Igweze. She's on Facebook as well. Ifunanya Igweze, Predify. It's a telemedicine platform tailored to pregnant women. She's doing something really wonderful with that platform because women are able to have 24-hour access to healthcare. So if they have a concern, they can quickly, on the it's a paid platform though, they can quickly get help or be advised accordingly on what to do. And in that way, because another thing about one of the delays that negatively impacts health outcomes is delay to get care, because one may still be at home deliberating, is this something so serious? I don't want to go and spend money now. I don't want to spend fuel and go to the hospital and do this and do that. So that deliberation, whether to seek care or not, also adds to the delay and then impacts negatively. But with such apps like Predify, and just to be sure, disclaimer, she's not paying me to mention her. These are just platforms I've seen. And then for Predify too, I don't know if you are mutuals on Facebook, but then I see the work she does. I know she's a doctor, and I know that that platform is tailored to attending to pregnant women, and she shares testimonials from time to time. So such things like that are encouraged so that women are able to get real-time attention. And then if it's a condition that requires immediate care in the hospital, they are referred appropriately. If there is a home remedy or a test to do or something to check at home, they do that. And then they're also able to check their blood pressure, check their urine and all, and then relay the results to the doctors for advice. And so the truth is there's a wide gap. There's a wide gap in development of these platforms, and there's also a wide gap in uptake. There's a wide gap in uptake. So these are things that with time, even though we have some issues, network challenges, cost and all, that is, would using these platforms mean added cost. These are still some issues there. But the truth is, they are going to really bridge a gap. Really, they are going to bridge a gap. So, I mean, if you want to talk about advanced countries, there's a lot they are doing. Even using telemedicine to provide make diagnoses, do medication refills, even for doctor-doctor interaction as well. A doctor can be in another location. For instance, if we have a case where that patient may not be able to safely move from that facility where they are to a facility, a tertiary facility where you have a lot of other, a lot of skilled obstetricians. There you have a doctor, but that is skilled to an extent. Through telemedicine, it can be guided on that surgical procedure. So these are things that are now available in developed climes, but they are still very rudimentary. In fact, not really, they are not yet in place in many government hospitals in Nigeria.
Yeah, but we won't be able to explore all the problems, but with the advent of social media, where everybody has access to at least basic a mobile phone, and with the social media platforms, I also think there's a lot that people can do to bridge this gap. And yeah, because the access is really alarming. So before we go, we're almost running out of time. What steps do you think providers can do? What can they do differently if this is brought to your table? What will you do differently?
First of all, advocacy. Because there's a lot of mistrust. There's a lot of mistrust for when you have something new, people find it difficult to adapt, to embrace change. So there needs to be advocacy over and over again, educating people. Like you rightly mentioned, social media. On my social media, I'm on Facebook. On my social media platform, I share information regarding women's health. I used to do that a lot. I've slacked a little, but I'm going to really pay attention to that again more. But then make advocacy, educating people, and then driving support in terms of funding for those platforms to be, because some people may, for instance, Predify, some people may trust that if they are able to overcome the trust barrier and then now trust that, okay, this platform may be of help to me, but then they can't afford it. So we also need to drive funding as well, so that these platforms can be funded for some people, so that some people get funding, so that people that are financially challenged in a way can access it. And then even more training for healthcare providers to be able to use it, because you may even find out that in a hospital now that we've just adopted EMR, you find out that it's not even very easy for some people to type fast, to navigate the software as well. So there's room for training and retraining. So advocacy, funding, training and retraining, these are the areas that we need to start from and then go from there.
Thank you for sharing your thoughts with us. We'll be speaking with Dr. Confidence Ogbomade. She is the Senior Registrar at the Department of Obstetrics and Gynecology, Nnamdi Azikiwe University Teaching Hospital. So, Doc, before we let you go, what's your final word for us?
Thank you. I just got to know about you this week, and I can see you're doing a wonderful work. And I hope many people get to know about the work you're doing. And this is also a good opportunity for people to also know about how technology can help bring down maternal mortality and crash the bad statistics, so that we achieve our sustainable development goals as a country. Thank you.
Thank you so much, Doc, for sharing your time with us, and we hope we can make some improvements in reducing these figures, and we look forward to better reports and statistics from that angle.